Welcome to another session of Collateral Nation with Dr. Chris Seenan. We are talking about walking as medicine for a disease that is more prevalent and deadlier than most cancers combined, especially colon cancer, breast cancer, and prostate cancer. So it's out there. You may have it. You may not even know it. You might experience leg cramps, neuropathy. They might call it diabetic neuropathy. You might think that the pain you have in your legs and that's preventing you from walking as far as you'd like, or the fatigue that you're feeling in your legs is simply old age, but it might not be. It might be poor circulation, and not just called poor circulation with nothing that anyone can do about it. It's poor circulation known as peripheral artery disease. So many doctors say, oh, yeah, you have poor circulation. And then they just brush you off and say, go home, as if that's enough for you. No, you need a diagnosis of peripheral artery disease. Ask for an ankle brachial index test, or ABI, where they put blood pressure cuffs on your legs and your arms and measure the differential and get that diagnosis, because there's so much you can do. Well, the number one thing you can do, which you think might be counterintuitive because it's also the thing you feel like you can't do, that is letting you know you even have it, is walking as medicine. Yes. Dr. Seenan is here. He is the Global PAD Association's Walking Therapy Researcher of the Year, and he's done a lot of research on this. Dr. Seenan, it seems counterintuitive to say that, you know what, you can't walk, but walking's the best medicine for you. How do you
Yes.
explain that to a patient that comes your way and says, okay, I just don't get it.
Mhm.
Really? I can't walk because of this disease, because of poor circulation. I've seen my walking ability decline over the past few months, but now you say that that's actually the treatment. That's,
Yeah.
in a sense, the cure.
Yeah. It's a really tricky one, and I think that it's one of the
I
it's
know,
one
right?
it's really difficult to go around, but it is almost also the reason why I'm so interested in it is because of that unique position in terms of this condition where the thing that causes you pain, the thing that you're the main symptom is almost the thing that you would want to experience. We encourage you to experience more of, which is almost counterintuitive in everything else. If you had back pain, or if you had arthritis, or if you have whatever other the condition is, we'd often say, oh, try and avoid maybe the thing that's making you feel worse. But actually, this is the nature of this condition means that it's the thing you need to do, and and I think the best way to explain it is that bit of, well, is to really think about what's happening inside the vessels and what's causing this condition. So because that pain that you feel in the legs is a symptom, not the cause. So that is almost the output of the condition. So the cause of this condition is the narrowing of the blood vessels due to that process of atherosclerosis, and the kind of the furring up, or the narrowing and the hardening of your arteries. And the thing that makes that narrowing and hardening, um, or slows the progression of that narrowing and hardening, or helps you build collateral circulation, so kind of bypasses around your blockages, or the bits where you've got narrowing, is walking, and is getting yourself moving.
I was thinking about it this morning as I was setting this up, that most doctors will tell you, avoid what makes you hurt. You say to the doctor, hey, my back hurts when I do this. Well, then don't do it. This is the one that they actually will tell you, if they know what they're talking about. Do more of it.
Mhm.
Keep it hurting. The hurt is good.
And
Push through it. Man up.
I wonder if that's perhaps why, I think as a physiotherapist, we often get labeled with this idea that we enjoy causing people pain. Often a physiotherapist is the one you go to who causes you more pain, and it's no pain, no gain kind of idea. And maybe that's why I was drawn to this condition, studying this condition, because it fitted with my MO.
You seem like such a kind guy. It seems like the antithesis to your personality.
Well, I don't know. It's just it's an outward veneer, perhaps.
Except you, I think you're the perfect person because you do have that kind soul, and that if anyone is going to tell me to push through the pain and make me smile about it, it is going to be you, I would imagine.
Okay, good, good.
We'll just go with that. We do
Yeah.
have quite a few people in our live studio audience. Our main topic du jour, as we like to do, where we engage everyone who's listening in, is we have an upcoming. I think we're going to do a big inaugural 2 hour, all about walking, 2 hour seminar on National Red Sox Day for PAD awareness. That is the third Saturday in February. It's February 15th, and we're going to make it so it can be broadcast across the globe and be at a time where everyone pretty much can tune in no matter where you are. Hopefully it'll be during the day, during the daylight hours at some point, or early evening for some. But we want every single person who is tuning in here to start thinking about what are the key elements that we need to include. It could even be your story. If you want to give a testimonial on walking is medicine and inspire others, we will log you in. You are welcome to join and speak up during that seminar. Don't be shy. So during this seminar that we're having right now, go ahead when you want to share what you think should be included, along with the question you may have for Dr. Seenan, go ahead. We might just put you on the spot as well. Just like Duncan, Duncan has joined our studio audience. He is brand new to the Global PAD Association and all of its events. This is his second event. Duncan, we're going to put you on the spot. Go ahead and unmute. And first, let me ask you your idea that you might have. What needs to be included in any seminar on walking as medicine? And you know what? It might include one of the questions you have today.
Okay. Well, thank you for the opportunity of speaking. I think, obviously, about walking, there's a question as how much should you walk? I've been told I need to walk 3 times a day. But I don't know how long I should be walking, what speed, what gradient. So I guess all of these things would be helpful to have some structure around the walking that you're asked to do. And also, I mean, I'm very fortunate in being able to walk in the vicinity where I live, but I guess other people may not have the opportunity to walk outside as easily as I have. Another aspect of the walking regime is how you measure it. So, in other words, if you're wanting to measure your improvement, are you measuring it in terms of the speed that you can walk whatever distance in, or are you measuring it just in terms of the distance before the pain starts? Um, and and how do you basically measure the improvement? I guess that's important because I think that motivates us to see that we're actually getting a bit better if we've got something that we can measure well. Um, yeah, and then the third thing is that I'm also doing some gym classes and some higher impact classes which involve a lot of bouncing around and hopping, and I wonder whether that is also helping in addition to the walking, not just as a substitute. So I think I probably asked enough questions there.
Dr. Seaman,
Thanks. Yeah,
what do you
thank you.
think?
Sorry, I was trying to find my unmute button. Um, Thank you, Duncan. They are very interesting questions, and thanks for coming along and asking that. The first thing I will do is I'm going to share something in the chat that I shared last week, and this was an infographic that we created a few years ago now, actually. But this was where we summarised the evidence for walking for people with intermittent claudication. So if you have that pain that comes on when you begin walking, the current evidence is the suggestion not necessarily 3 times a day, as you've maybe been told, but 3 to 5 sessions per week is generally what we recommend.
Okay.
But within those sessions, to walk to kind of 30 or 30 minutes to an hour for each of those sessions, and to try and walk into pain is the other thing that we generally recommend. So these are that's kind of an outline of the general recommendations, but I'm happy to kind of, I think for each and every individual, what works is often something that's different. So some people, kind of it depends on your lifestyle, depends on, as you say, what resources and kind of landscape or environment you have around you in terms of what walking you can do, or whether it's something you do on a treadmill in the house, or if it's maybe even going to the swimming pool or the bike, or as you say, the gym. And all these additional or extra things are beneficial as well. So the thing that I normally kind of try to explain is that when you do your walking or exercise for people with peripheral arterial disease, generally there's two different mechanisms or two different things you're trying to work on. So one is your general cardiovascular fitness, because peripheral arterial disease in itself, that kind of the pain, the clogging up of your arteries in your legs, and is dangerous in itself. But the other thing that's even more dangerous is the cardiovascular disease, so the heart attack or stroke or other cardiovascular conditions. And peripheral arterial disease is almost a warning sign that you have this atherosclerosis going on within your body. So it's even more important for people with PAD to look after their risk factors. And so that's what I mean in terms of being walking and exercising for your cardiovascular health. So anything that raises your heart rate, anything that gets your blood pumping is going to help. The second reason for exercising is to try and hopefully increase the distance you can walk before feeling pain, or how far you can walk in pain. And that's why we often recommend walking, because walking has been shown in the research studies we've done is to be the exercise that helps the most with that, with increasing that walking distance. So that's often why we talk about walking, but it's not meant to, but all other exercise is good exercise too. So please continue doing your hopping and jumping and anything else that works for you. That's brilliant. Dora, do you want to come in there? Sorry.
I think that's very helpful. When we talk about the walking regime or as an exercise, then obviously we have to have rests and to stop at a certain point.
Yeah.
And my question is, if you can continue to walk, should you still have the rest? I mean, in other words, is it important to bring the rests in, or should you walk until you absolutely can't walk any further and need to rest?
The latter. Walk until you absolutely you need to rest, I would suggest. I think again we don't have the research evidence isn't developed enough to know conclusively that you absolutely have to walk into this kind of excruciating pain. And I think for some individuals, walking into that level of pain can be so off-putting that it's counterproductive. So if people think, oh, I'm so miserable here every time I walk, I'm in such pain that I don't want to walk, it's much better to be walking than to not walk. So
Mm.
I think take that into consideration. But the one thing we do know is that in terms of building collateral, or building these vessels that grow to help kind of grow around the blockage and increase the blood flow getting down into your feet and down to the bottom of your legs, walking as far, pushing as far as you can is helpful.
Okay.
It increases that the more you can experience that pain. Generally, we think that it helps with the growth of those vessels.
Thank you. It's a good
And
answer.
Duncan, based on what you heard, and this being your first time here, is there anything in particular that he said that you say, oh my gosh, that would help so many other people? You need to include that in your upcoming seminar?
Well, I think
All of
all of
it?
the things that he's just said would be really useful. I mean, particularly the last point, because everybody can walk different distances, and what I've picked up is that the level of walking ability is very different between within the group.
Hmm.
But what I found is that people have said to me, "Do you need to rest?" And I felt I don't need to rest. But then others have said, "You ought to rest now because the rest is what you need." Um, and what I'm hearing now is actually, if I don't personally feel I need to rest, then I should continue to walk until I do feel that.
Hmm.
So that to me is really helpful.
Great. I think the one thing I was going to add on to that, you also asked about how to measure this and what
Yes.
can help with that, and I would suggest that Kim has developed a fantastic app for your smartphone. So if you have a smartphone, you can download this app, which helps you track how far you can walk. And what that does is it provides a kind of a prompt to suggest that you go and walk. And then whilst you're walking, you can push a button to say, I've started walking. And then when you first feel that pain, you can kind of push a button to say that that's the pain coming on and how far you're able to go. And what that does is that's a really useful way of measuring what you're doing, how often you're walking, how far you're walking, but then and it's a good way of kind of tracking
Mm.
how it's changing and how it's and it can be quite motivating to say, oh well, like 2 weeks ago I was able to X amount of distance and now I can do this before I feel the pain.
Yeah.
And I know Kathy wants to jump in. Kathy, go ahead. You got to unmute though.
I've just done it.
There you are.
The point Duncan's made up, to me, this is the holy grail of this, because when I was first diagnosed, I was already walking and walking miles, and I didn't need to rest. I had to rest from the pace I was normally walking at, which was I had to slow it. It was normally about 3.8 mile an hour. I couldn't do that because one leg was stopping me. But my gut told me that to keep my heart going, I needed to work hard. But I was getting, as Chris said, to the point of crying in agony because I wanted to walk. I wanted to do a 10K race. I did a 10K race. I landed in hospital with a weird heart rhythm. No one could explain it, but it was definitely that 10K race that did it, and I'd never had that problem before. And I think it's because I really pushed my legs, and I did something physiologically that wasn't right. I should have stopped 8 miles in, but I didn't. But I really needed to stop and recover at that point. And that was really at the point at which, yes, you need to stop and recover. If you know you're doing yourself harm, and you'll soon know it because you'll be gasping. I was coughing up blood. At that point, you're supposed to stop, but I didn't. But when I was checked out, they couldn't find anything wrong with me. I didn't have any problem, but something had happened. So if you can walk comfortably, don't stop. That's how you build capacity. And then you'll find that you can maybe increase the speed you can walk at. But the mantra of how fast, how far, how much time, on an incline, on the flat, I struggled with that, really struggled with it, because I was just told to go away and walk. I was already walking. I didn't smoke. There was no modifications I could make to my lifestyle.
Kathy, sorry. Yeah. I mean, the problem that I've had with what you've suggested is that it's very hard to get any measurable variation. So if you're talking about how many minutes do you need to walk a certain distance, let's say minutes per mile, right? Then whether it might be 20.1 or 21 or 20, but there's not much variation there. You can't really see much progression. It's in the same way as but perhaps with Kim's app, it's probably much better tailored.
I've got a smartwatch, and I went out and bought a treadmill. I went out and bought a treadmill months of diagnosis, and I got on the treadmill and I did interval training where I would walk at my fast pace till I couldn't walk anymore. Then I would turn the speed down, keep walking. As soon as I recovered at the slower speed, I'd turn it up again, do the fast pace. And what I found with pushing myself with the interval training was overall, I had a much better quality of walk. And I was keeping my car.
That's interesting.
Walk painlessly round the woods and painlessly on a beach and painlessly round a shop. But if I tried to do what I would normally have done before I had the blockage, I couldn't do it. And I've never been able to do it since. But 19 years on, I can still walk round a shop. I can still walk for a train in a hurry, as long as the distance is manageable.
Yeah.
So it's about finding the sweet spot for you. I used to measure bricks in the wall and time it when I used to go out every lunchtime on the same walk where I worked. I would walk the same route at the same speed, and I would see how long it took me to get to a brick in the wall before the pain started. And then I would measure it from there. And I would climb 100 steps to my desk without stopping. And I knew if I could do the 100 steps without stopping, I had not gone backwards. And I think something the other week was really important. Sometimes being the same is progression, because it's a progressive illness. So you're not, because there's another person on the UK board who she was a smoker. She couldn't understand what had happened to her. She was very active. She was walking miles. And she gave up smoking immediately and she kept walking miles. And then she said, I've cracked it. I don't have any pain. So that's great. I'm fine. And I said to her, that's wonderful, but you're not fine. You need to now go faster. So then she stopped walking miles and started climbing mountains. And she's achieved things she thought she would never do. And she has a relatively normal life, whereas it was impeding on her life. It hasn't stopped her, it's made her determined. She's only in her 50s. It's made her determined to keep this at bay. And when you're younger, you need to do that, because when you get older, it's much more difficult. You lose muscle mass, and just keeping the capacity going is much harder. So it's like putting money in the bank that you're going to draw out later when you need it.
It's interesting, Kathy, you're bringing up such a really good point. I had this conversation yesterday with the CEO of a data analytics company for healthcare called Crescendo. And he couldn't believe when I told him that here in the US, Science Direct has reported in the past year that they've seen a crazy influx in patients between the ages of 18 and 27 who are presenting at advanced stage CLI on deck for amputation in the emergency rooms, which is really scary. If it's scary that they're so young, because it used to be considered an old person's disease without treatment, but it's scary because we don't have anything, surgically or medicine wise that can truly stall the progression. The only thing that works is walking as medicine. And so this becomes even more important for these younger folks to kick the can forward, kick the can forward, kick the can forward, because there is so much that they can do. Keep progressing. You know what? It might be a part-time job to walk, walk, walk. But Dr. Seenan, is this, accurate to say that they have to do exactly what Kathy says, which is to keep challenging themselves? You don't feel that claudication anymore? Well, push yourself even further sooner. Push yourself, push yourself, push yourself.
Yeah, and certainly for if you're looking to get those gains in terms of distance and moving yourself forward, and as Kathy said, it's almost it is money in the bank, and so the more you can do, the better. I think the interesting. I've got that infographic poster up on the other screen here, and one of the things it says is some is good, more is better, make it a habit. And I think that is quite useful. I mean, I think we all need to be kind to ourselves in all this, because, as you just mentioned, it becomes a part-time job or almost a full-time job. It's a lot to manage this kind of weight of of managing your condition. And so I think that you be kind in terms of, if I'm doing some, that's great. That is good. If I can do more, that's excellent. That's even better. Really reward yourself for that. So yes, if you can push it more, do more. But what's most important is that it's a habit, and it becomes part of your lifestyle. Because unfortunately, with this condition, which is one of the other horrible parts of it, is it doesn't go away, and it is progressive. So without the kind of pushing, without the exercise, without managing the other risk factors, will continue to get worse.
Yeah. And so we have some other questions coming in. We have, Kathy, you have one from another lovely PAD warrior in Scotland.
I do, yes. I'm not, you can hear me, yeah?
Yeah.
Yes, we can.
Yeah. This is a question from Rose, who's in the South Lanarkshire area in Scotland. She's still waiting on her vascular appointment. She's been waiting a long time, and she's struggling with pain, but she is pushing through it. But a bit like Duncan said, she's wondering if she just keeps walking in this pain, is it enough, or does she need to do more? And we're back to that same conversation about, how do you judge the pain, the point at which you've got to stop? I think she just needs to feel that she's doing enough,
Yeah.
but she also needs the encouragement that she's doing the right thing, because she's not yet seen the vascular surgeon. And I don't know, I'm not really au fait with this area, but I do understand from what I read that if you've arrived at the narrowings through smoking, you're going to have them in your iliacs. as opposed to in lower vessels, and which are more diabetic or glucose related. And that if you have disease in your iliacs, walking is very hard to make progress, whereas disease in the lower leg responds quite well to walking. I don't know, and I wonder, I don't know the details around Rose, what may have caused this. I know for me it was never smoking, because I've never smoked. But would that make a difference if your disease is in a different part? Are you just kind of, it's going to be painful and it won't improve, or I don't know enough about that.
I'm wondering, from Dr. Seenan's perspective, we did talk to Dr. John Phillips, an interventional cardiologist, a PAD specialist in Columbus, Ohio, in the States, just on Saturday, and he was saying that when there's disease in the iliacs and it gets above 75%, he said he tends to want to go in there and do a little roto-rooting and drug-coated balloon and stent it, because the stents in that particular area are pretty durable. Anything in the abdomen area and above are fairly durable. And he doesn't find that walking seems to really stall the progression. If you're at 50%, 60%, they'll say to walk, see if it's possible to maintain, and keep you going for longer. But he said once it gets above 75 to 80%, and the person is incredibly symptomatic to where it's lifestyle limiting, he does tend to treat, because he doesn't find walking is as effective once it gets to that point. I don't know, Dr. Seenan, it might be an interesting research study if one hasn't been done.
Mm-hmm. Yeah, a good point. And I must admit, again, it's a wee bit out of my scope of practice. Obviously, those kind of questions in terms of when to intervene and such is very much more in a vascular surgeon type thing compared to myself as a physio, where my expertise is around the exercise. But it does make sense in terms of obviously and I know in terms of interventions are more likely to be successful with a bigger, larger vessel. It's easier to I guess to intervene in that situation. I think what's really important to kind of grasp around all of this, and this is about almost the what is the right exercise, or when is it right to intervene or not intervene. I think it's really important for us all to hold that it's different for everyone, and it totally depends on your situation. As we've just mentioned there, it'll depend on your why you have PAD. What was it that kind of caused it? Was it smoking? Was it other lifestyle? Was it genetic? Was it what was it that's going on? That'll change the experience of the condition. What is your lifestyle? What do you need to do? What are you hoping to do? And what is it limiting you from doing? That will contribute. And then everything else about what other conditions you have, or what else is going on in your life. So I think it's very difficult almost to have this is the right answer type thing for what Rose is asking about here. It will depend on her condition and her disease. And I'm wary about saying, oh no, Rose, you must do this, because
Yeah.
I don't actually know what her situation is, and what her disease state is, and that would impact. So I think the key thing is those general messages about creating an exercise habit is never going to be detrimental in this condition. So you're not experiencing of that's the other thing, that pain you feel is not harm. There's no damage happening within your vessels when you experience that pain. So that is a definite. So walking and exercises, and when you have any sort of cardiovascular condition, including PAD, exercise is helpful and it's beneficial, and it helps reduce the pain. It helps improve your sleep. It helps improve your mental health. It's so many benefits. So I think those are the things to kind of focus on.
Yeah.
And Amy has a question. Amy, go ahead, unmute and ask your question of Dr. Seenan. Or else I can ask it. But if you want to ask it, Amy, it's all up to you.
Okay, I'll unmute.
Fantastic.
So, doctor, I have blockages in my left SFA and in my iliac. My claudication pain is primarily in my hips and in my back. So, but when I walk supported, like using walking sticks or using the handrails on the treadmill, I have much less claudication, or it's harder to bring it on. Whereas if I walk unsupported, the claudication in my hips often is immediate and debilitating. So do you have any insight as to why that would be? And is it okay to use the walking sticks and the handrails, or should I try to push through without them?
Good question. Thanks, Amy. In terms of why that happens, I suppose it does make sense in terms of when you have the support, though the muscles in your hips and your back won't be working so hard. So the minute you if you use a stick or leaning on the support rails on a treadmill, then those muscles won't be kind of switched on as much, and so therefore less likely to be in pain. In terms of, should you try to push into that pain? I don't know, and I think I would need to know more again about how your condition and your specific experience of it. I think again, be kind to yourself, and if you're able to walk without pain and to be able to walk on the treadmill or using the aids, that's getting you walking. I would always encourage that more than necessarily trying to push into, as you say, debilitating pain and then not walking. I think that's probably less useful.
Thank you.
Nice.
Fantastic. And then Lynn has a question, but she wants me to ask it. So I will go ahead and grab that. She says, Dr. Seenan, that you stated the disease, of course, is progressive. Can we expect it to remain static at all if we are on the meds and walking? How will we know if disease has progressed, as we don't appear to have any regular reviews with the doctor?
Right. Yeah, again, a really good question. So the disease is always progressive, but yes, you can. And I think there are many examples of individuals who, with appropriate risk management, so risk, so if you, as you say, taking the appropriate medications, making the lifestyle choices and say reducing things like smoking and watching diet and controlling diabetes and all these other things that you need to do, it is realistic to think that you can almost stall that progression or limit that progression. The way that you would notice that, amongst other things, would be your walking distance. You would obviously hopefully see a consistent amount of walk, or like at least a not considerably shortening walking distance. And the other thing is, if you are going for a medical review, then they would normally do the ankle brachial index test or ankle brachial pressure index, or even a Doppler scan, perhaps if they're using ultrasound to kind of view the blockages. Those figures or the kind of the outcomes of those tests should hopefully show the progression of a disease. Obviously, what you mentioned there, Lynn, is you're not getting a regular review, so it's quite. I'm not sure about your situation, but if you're able to request one or find one, I know that certainly in the UK, if anyone under vascular, I believe, and Kathy, correct me if I'm wrong, or anyone else, correct me if I'm, but normally you would have maybe a yearly review or a 6-month review, perhaps, where you would get these tests done so you would be able to tell your if how your disease is progressing or not.
But the doctors always tell you, the vascular specialist will tell you that diagnostics mean nothing. It's feeling is everything. And so trust what you feel. If you feel like you're improving, measure the walking distance. We do have the app through the Global PAD Association that allows you to not only monitor your progress and specifically your claudication time, the time at which you start feeling the pain, to the time that pain gets so bad because you're pushing through it that you need to rest. That should improve over time. And if that's not improving over time, definitely call the doctor. If that is improving over time, they don't care if you have a blockage. They don't care how many blockages you have. If you're feeling better, that means your body is responding in the miraculous way that it knows how, which is to grow those natural bypasses around those blockages to feed your lower foot. Does that sound about right?
Definitely. Yes, I would say the second that. Absolutely. Listen to your body and listen to that's again maybe going back to that question Duncan was asking, how do you measure things? And if you can measure and be monitoring how you're getting on, then do that as much as you can.
And I have a question coming in from Facebook, and then we're going to get to Heinz and Marcia. But Rudy is asking, and and he's been very patient. No symptoms, was tested, totally occluded left leg, 50% on the right, 2 laser atherectomy on the left. Laser atherectomy is that roto-rooting, but in this case, instead of like a sander or a device that drills, this is a laser that is used to remove some of the plaque. Possible that I was plaquing over my lifespan and just naturally built some collaterals. And so he's feeling okay despite, all of the blockages after a couple procedures here. But he's wondering, do blood thinners help, and how about statins? So the medications, right, can really help. I don't know how much research you have done on the fact that if your blood is a little thinner and they put you on those blood thinners, the thinning of the blood does help the blood squeak through or eke through the smaller collateral vessels with a little bit more ease to supply your lower foot.
Yeah.
That's my understanding. Yeah.
Yeah, absolutely. And same with the statins, so that's what's really good about this condition is we do know what medications help, and they have got medications that do make a difference. So obviously the statins help control levels of cholesterol, and controlling levels of cholesterol help kind of reduce that build-up of the plaque, which is associated with that. The blood thinners, as you say, if you've got any narrowing of any artery, whether it be your or the narrowed collaterals, or any narrowing in your main vessels, if your blood is kind of thinner, with the medication, then it will more easily get through and get to the kind of distal parts of your limb. So yeah, that's really helpful.
And even I don't know if you've had a lot of experience with the cilostazol, which is the vasodilator. That seems to help, some patients. And one of the doctors who is a vascular specialist and a little bit more into the holistic, for those patients that can't use the cilostazol, he always suggests ginger capsules. I had no idea that ginger was a vasodilator.
I do. And I must admit, both the medications and the holistic alternatives are not an area of my specialty, but that's interesting to hear.
I just thought it was interesting. It's always worth asking your doctor about. Heinz, go ahead and unmute. You've been incredibly patient. Thank you so much.
Hi, doctor. Question. This happens all over the Northern Hemisphere right now, where it's getting colder out and you're walking. So, I can read online till I turn blue in the face about all the articles about what happens to your blood if you have cardiovascular disease. But, like this morning, I walked in 12-degree weather, and I draw the line at 0. So the dog's got to get out. So,
yeah.
But with that, what's your take on walking in cold weather? What does that do to you? I noticed lately my hands get cold a lot easier, even though I dress warm. And it's not while I'm walking, it's once I'm in the house. All of a sudden, I'm sitting there and my body seems to get chills, even though I dress warm. And eventually it just goes away. But, at first I thought I had other illnesses, but I'm just, between me and my PCM, we just seem to think it's all related to my pad. What's your take on all the blood flow while you're outside in the very cold weather?
Yeah. Well, I mean, it makes absolute sense in terms of your blood vessels. The way that your body responds to cold weather is all about vasodilation and vasoconstriction. So vasodilation being the kind of expanding of your blood vessels to allow more blood to reach the kind of your peripheries, or your hands and your feet, and the vasoconstriction when the blood vessels get thinner and get smaller. And now, so in cold weather, what your body generally tends to do is vasoconstriction. So kind of the muscles around your kind of arteries will contract and make the arteries smaller, so that less of your blood reaches the kind of surface of your skin or your peripheries. And the reason it does that is almost a self-protective mechanism, because if it allowed all the blood to get to your surface, it would lose a lot of the heat within your body. You would lose a lot of heat from your body. So it's a way of keeping your internal temperature stable and keeping you warm. So yeah, and obviously if you have pad, then you have a kind of increased narrowing of your vessels already, then that's just going to make that even worse. So as you say, what you're experiencing in your hands, it will probably be related to your pad, because when you have narrowing of your vessels in your leg, you'll also have narrowing of your vessels in your arms and into your hands. And often you don't experience anything in your hands because you don't use your hands in the same way as you use your legs generally in terms of walking. But maybe in the cold weather, that's when you'll start to notice it. Um, so yeah, it does make sense, I suppose. I don't know if that helps answer your question.
Does that help, Heinz?
It sure does. Thank you, doctor.
Nice.
And Marcia, if you don't mind, if I start out your
Please do.
comment or your question. Okay. So we love Marcia. Marcia has been doing our Moving Mondays because she is a certified Tai Chi or Qigong instructor, and she's amazing. And she has to have a partial toe amputation on Monday. They have worked so hard, but they did not do a test for osteomyelitis a year ago. And so, of course, that means that the infection is still there despite some blood flow. But now, while there's blood flow, they said it's a good time. In terms of her rehab afterwards, she wants to get back walking. And she wonders if you have dealt with, and then she can get to the other question or correct me if I'm wrong, but I'm actually asking on her behalf because I'm going to be by her side, hopefully, in her journey here. But how do you start rehabbing following an amputation to improve your circulation, improve your gait, so that you can walk to grow your collateral vessels? Are you losing time while you're literally not able to walk while you're in recovery? What is the process for her? Any guidance? Probably for both of us, right, Marcia?
Yeah,
Absolutely.
it's a tricky one, and obviously, um, there's no avoiding the fact that a procedure like that, the recovery of a procedure like that, will have an impact on your continued work, the continued work that you will be doing to kind of keep active and keep exercising. So I think in terms of, is there something that you could be doing, or what do you do in that situation? It's you do as much as you possibly can, or you kind of continue with what works for you within that situation. When and working in practice, when in working with people post amputation, I mean our approach is very similar to in terms of to anything else in terms of problem solving. So you just see how, because every amputation is different, every person's situation is different. So you just see you'll see what you're like after you've gone through the procedure, and you see what can you manage, what can't you manage, how are your pain levels and things like that. And wherever you are, hopefully you'll be seeing a rehabilitation specialist who will help you, get back onto your feet. And whilst you're not on your feet or not able to walk, it'll be important to kind of find another way to kind of keep your legs moving, to keep your and to keep exercising as much as you can. So if you're in bed, if you're sitting, then it's a case of kind of doing some general exercises of your legs, or using a static bike. And if you can't do anything with your legs, then think about what can you do with your arms, what can you do with your upper body to kind of keep the heart pumping and keep your fitness.
Yes, thank you so much, Doctor. I'm feeling rather optimistic today, and I'm looking to the future of my improvement post amputation. And I had a question for you about wearing ankle weights. Do you think that those would help collateral blood flow? I'm certain they would help grow muscles because my right leg is so skinny now from lack of blood flow. And I'm just wondering if, ankle weights might help.
Yeah, absolutely. I mean, it's the same idea as people pushing themselves by walking up inclines, as Kathy says, or testing yourself on stairs. Anything that makes your muscles work harder is going to help, encourage more blood flow and therefore growth of collaterals. So yeah, that does make sense to me. So yeah, if the ankle weights work and something that you can work with, then yeah, I would go for that.
Yeah, it sounds like a good idea since I live in Flatland, Florida.
Hmm.
And I even find walking on my treadmill, even before the amputation, I can walk. I don't get leg cramps or leg pain. It's the toe pain that makes me stop.
Right.
So, in that sense, I'll be happy to say goodbye to this toe and get on with my life.
I'm really hopeful, and good luck with the procedure, and really hope it does help a great deal. It sounds like it should.
Thank you so much. And one last word. Thank you so much for your diligent weekly chats because I don't always get to tune into them, but I find looking forward moving post amputation that they're not only very educational, they're supportive, and they will help keep me motivated.
Great. Well, I'm glad to help. Thank you for your nice comment.
Thank you.
And a great way to make them feel guilty for not doing one.
Yeah, better not stop now.
Marcia, we love you. And Marcia, while you're still on and unmute again, we just wonder, you've been to quite a few of these, and just from your perspective, if there's anything that you've learned, throughout the journey here about walking as medicine and what you've learned from Chris, what you've learned from the groups, et cetera, and your own experience, what would you like to see included in the coming seminar where we try and pack everything into 2 hours?
I would like to see, and I know it's hard to do, but maybe some various tips for people's different situations. Because, like, okay, I'm having a toe amputation, but what about someone that has all their toes? What about someone that has an above knee amputation? So maybe some different little tips to address some of these different factors, I think might help people feel more included in the conversation.
Fantastic. Thank you, Marcia. And I have two more questions that I've gotten in. Number one is we have Derek that is asking about issues with back pain. He said sometimes that he just doesn't know if it's really the back issues that are causing his pain or his leg. And we've talked about, the differences, but he is concerned that getting his legs fixed won't help his back, and he's still not going to be able to walk anyway. How do you deal with those patients that have back issues that are debilitating, and yet they have pads? They have that ultimate perfect storm here because they claim that they can't walk with their back issues, but they need to walk for their leg. They just feel like they're throwing up their hands up in the air and they just don't know what to do.
Yeah, it is really, really hard, and I think as Marcia's saying, and it sounds like this other individual in terms of pad never generally comes by itself. There'll always be something else, or each experience is slightly different, and if it's the minute you have something else, it just makes it 10 times harder. In terms of the back pain, again, it will probably depend on the type of back pain, the experience of it, where it is, and what they've tried to kind of help fix it, I guess, or help kind of reduce that experience. One of the things we often, recommend for back pain is gentle walking exercise. So but then again, if you've then got pad, which is reducing the amount you can walk, it's, as you say, it's this perfect storm. I think that what I would recommend is just kind of seeking help for each individual problem from the appropriate people. So for the back pain, have they been to see someone specifically for that issue and trying to kind of get that managed as best they can, and then while dealing with that, also just try to kind of chip away with the leg pain at the same time. It won't be easy anyway.
And Sarah wants to know about just some basic exercises that it seems to be along, Marcia, she had a TMA, and she just wonders if there's any exercises that she can do while sitting in her chair that could help improve circulation. And well, she can't on her one foot, but even on her other foot, up on her tippy toes, back down, pushing the accelerator button. What do you usually, drawing the alphabet? What do you usually suggest? And that goes for those that are sitting in the hospital bed, waiting for care. We have a gentleman in a Michigan hospital right now that is waiting for discharge, and he's been waiting for hours, but they're just making him sit there. That's not good for your circulation.
No, yeah, and I think all of these things will work. Again, there's not there's not a correct exercise to do. So it's whatever works for that individual. So, but the key things to think about are what is going to make my muscles work the most. So yeah, the pushing the accelerator pedal, that kind of like bending and pointing their toes is useful. Drawing the alphabet, again, if that makes it more engaging and more useful, then that's great as well. And then for those who maybe have, if your blockage is higher up, then bending and straightening your knee can be useful as well to get your quadriceps muscles working. The one thing I tend to do is often just kind of pointing and bending up your foot doesn't by itself, without pressing against anything, doesn't necessarily kind of produce enough force. So I think I've seen Kathy during this, even during this time, doing the heel raises as she's listening, and others that kind of thing is fantastic because you're using the weight of the body to kind of make those muscles work. So, and I use those elastic bands, we call them TheraBands, but any resistance bands to kind of loop around the bottom of your toe and push against those resistance bands, a bit like doing a heel raise, and will help in that situation as well.
And final comments, I think, since you mentioned Kathy, and Kathy just wrote a novel in chat. Do you want to summarize that, Kathy, as we're heading out here? You always have some great insight and experience to share, and you're leading by example with your tippy toe raises. You got called out.
Yeah, no, I read an interesting paper on this. As we get older, we spend more time at home, and PAD is one of those diseases that can limit your social life. People lose the confidence to go out because they think they might not get to a place, they might not get back. It's too difficult. The public transport's too difficult. So, people should look at maximising what the potential of their house is. Even, what's available in your house. Do you have a step? Do you have a flight of stairs? Do you have a path with a rise on it? Do you have a terrace? Have you got walls that you can use usefully? Or if you were going to have things in the house, things like, as you say, TheraBands that don't take up any room at all, that you can use in your house. And I don't know, Douglas was talking about walking on paper plates. I've never tried that. I'd be frightened that I would
just
slip.
shoving them back and forth.
But yeah, I think that's worthy of attention because people feel they have to go for a walk or go to the gym. But I'm a real big believer in fidget activity. I never sit through a set of adverts, and I like to watch television with adverts. If I'm watching it, I get up every single set of adverts, and sometimes I'll run up the stairs and do things up the stairs, come back down, and then 15 minutes later there's another advert. I love Frasier in the morning because it only runs 10 minutes before there's an advert. Then I get up. And I have found that it's made a huge difference to my general fitness levels. Just not sitting for longer than an hour.
I love this, that Dr. Seenan is just smiling as you're talking. I know you have to run. You're really, really busy, with clinic and research and things like that. Final thoughts from you, Dr. Seenan, before you go, but I'll leave this line open. We'll continue to be live because I would love for all of you to participate, share your stories, share your experiences, ask some more questions, help us plan for that upcoming seminar that we have, and I'll start a list of topics that you want to discuss. But I'll give the floor to Dr. Seenan to close out. And we really appreciate your time with us. And I don't know if you want to join us next week or if you want to wait till the following week. Whatever you want to do. We always are welcoming you.
Thank you. And yeah, thanks once again for it's really engaging and interesting conversation. I think I was just smiling there because of Kathy's advice is just excellent and exactly the kind of the model of which I wish I could adhere to, let alone anyone else. But I think that's being creative, taking any opportunity you can. I can see in the chat as well so many others coming in with suggestions of different things that you can do, and I think that's the one thing if you take anything away is to feel like you have some power, some control, and there's lots of things you can be doing, and not to feel as little frustrated as possible by the situation, and know that every time you do one of these things, you're adding to that bank and helping your your situation. So yeah, thank you everyone for a time.